Welcome to the Outdoor Emergency Care presentation for oxygen administration. Oxygen is the chemical that allows the cells of the human body to function. Our ambient air contains 21% oxygen, and the rest being nitrogen. Oxygen therapy allows us to increase the percentage of oxygen that's being inhaled by the patient. And oxygen is a drug, one of the few drugs authorized for OEC technicians to administer. Because oxygen is a drug, we want to make sure that we are administering it to the right patient, make sure that we have the right indications or reasons to give the drug. Any patient that's short of breath, seriously ill, or seriously injured may be a candidate for oxygen based on our assessment. Oxygen is delivered to us in compressed gas cylinders that are under high pressure, and they come in different sizes. The sizes are seen here. The most common cylinder that we deal with as ski patrollers is the D cylinder, seen in the middle. Also have a jumbo D, which is just a little bit bigger, and the E cylinder, which we use in the first aid room because it contains more oxygen and will last for a longer time. When working on the mountain, it's important to understand how much oxygen you have to give to your patient. A full cylinder contains 2,000 pounds per square inch of pressure, which equates to a certain number of liters of oxygen contained inside the cylinder. There's a safe residual pressure of 200 psi, so if you see 200 psi on your regulator gauge, the regulator may no longer be functioning correctly and may not deliver the correct concentration of oxygen to the patient, so you should change the cylinder for a new one. Each type of cylinder has a cylinder constant, which allows us to estimate, based on the usable pressure, how much oxygen is contained in the cylinder. So for a D cylinder, which is our most common cylinder, the cylinder constant is 0.16. If we figure we have a safe pressure of 1800 psi, that gives us 288 liters of oxygen inside the cylinder. So at 15 liters per minute flow, which is typical for a sick patient, that gives us 19 minutes to get that patient off the hill. Now, you don't have to have this memorized. This is on page 309 in your 5th edition textbook. Take a look at that. Just be aware that you have pretty much this hard 20-minute limit to get your patient off the hill before you're out of oxygen. When we're using oxygen, we want to be mindful of certain safety factors. First of all, it does support combustion and will make any fire or flame that it comes in contact with much worse. In contact with petroleum oils or other materials, it can spontaneously cause ignition. And it's a gas delivered in a cylinder under high pressure. If you break the top off and the cylinder goes flying across the room, it will definitely break things and hurt people. Keep the outlets and gauges on the regulator pointed away from yourself when opening valves on the cylinder. Compressed gases commonly use a pin index system for safety to be sure that the regulator being used is compatible with the gas in the cylinder being used. For oxygen, it should look like this. In the center is the inlet where the oxygen flows into the regulator. That should be surrounded by an O-ring, which should always be present intact and undamaged. You have two parallel pins, which should correspond to the holes on the cylinder that you are using. Different types of gases will have different patterns of pins and inlets. At all times, protect the oxygen cylinder from falling or damage. Open and prepare the kit. Verify the cylinder is the right drug, oxygen. Open the cylinder valve using the wrench. Verify that there is adequate pressure in the cylinder. 2,000 pounds per square inch is full. Connect your delivery device to the regulator. Set the leader flow valve to the correct flow rate. Apply the delivery device to the patient using correct technique. If the cylinder is empty, remove the delivery device from the patient. Turn off the leader flow valve and the cylinder valve. Bleed any additional pressure from the regulator and remove the regulator from the cylinder. Verify that the new cylinder is the right drug. Verify the condition of the O-ring and the pin index system. Be sure that it matches your new cylinder. Crack the cylinder valve to remove dust. Apply the regulator, align the pins, and tighten finger tight. Open the cylinder valve using the wrench. Verify there is adequate pressure. Connect the delivery device. Set the correct leader flow. And apply the delivery device to the patient using correct technique. The delivery adjuncts that we use include the nasal cannula shown here. This is properly applied. The prongs go into the nose, not up the nose. And these are set to 1 to 6 liters per minute and deliver 24 to 44% oxygen. The rule of thumb is they deliver approximately 4% more inspired oxygen per each liter of flow that you use. These are generally well tolerated by patients, preferable to a mask in that they don't cover the face and cause that sensation of claustrophobia. And this is properly applied around the ears, under the neck, and cinched up but not so tight that you pinch the patient. Another adjunct that we use is the non-rebreather mask. This is for a patient who is breathing spontaneously but is quite sick and requires a high concentration of oxygen. These are set at 10 to 15 liters per minute, and they deliver 80 to 90% inspired oxygen. Having the mask on the face may cause the patient some anxiety, so you may need to do some calm, quiet coaching with the patient to get them to tolerate it. Prior to applying this to your patient's face, this valve here should be held closed while the oxygen is flowing, and the bag should inflate to approximately 2/3 full. This bag is a little bit over full. The third delivery device that we're likely to use is the bag valve mask, and you should be familiar with this from CPR class. This is used for patients who are not breathing or who may have inadequate breathing and need assistance taking a breath. These can be used with ambient air or they can be connected to oxygen. And when they're connected to oxygen, you want to use high flow, 12 to 15 liters per minute. And these will deliver an inspired oxygen percentage of 80 to 100%. The reason this is called a bag valve mask is because it has the self-inflating bag, which you hold onto and squeeze, the valve, which means that air or oxygen flows into the patient and not back into the bag, and a face mask. It also should have an oxygen reservoir, which inflates similar to that on the non-rebreather mask, and a supply tubing that's connected to our oxygen regulator. As you should have learned in CPR class, or you will in OEC class, the most effective use of a bag valve mask is with 2 rescuers, one to hold the mask seal, which is the difficult task, and the other to squeeze the bag. Can be used with a single rescuer, and you should have learned your EC finger position, but this is less effective than the 2 rescuer technique. Another tool that we have in our oxygen kits is the pulse oximeter. And this shines a specific frequency of red light through the patient's fingernails so that we can tell what percentage of the hemoglobin in their blood is saturated with oxygen molecules. And we want that to be greater than 94%. 95 or higher is a perfect A for the patient on their oxygen. So if they have that, they probably don't need supplemental oxygen. And if they are less than 94%, then we're going to start giving them oxygen by nasal cannula and non-rebreather, or helping them with a bag valve.